Hi, Dr. Gorman. I'm going to do Goni and MMT for the knee next, so flexion and extension. So for the goniometer, range of motion testing, your landmarks are going to be the same for both flexion and extension. You're going to use the lateral epicondyle for your fulcrum. Your proximal arm is going to be the lateral aspect of the femur, using the lateral epicondyle and the greater troch right there for reference. And then the distal arm is going to be the lateral midline of the fibula, using the lateral malleolus as your reference point. So for Zach, just get him into position. You're going to take the knee. You're going to stabilize the femur with your hand, and then I'm just going to get this going. So he's going to be 152 for knee flexion. And then for knee extend, and the normal for that is 135 for knee flexion. For knee extension, we used a big roll because he's on the bed, and so it was difficult to get his leg off the bed. There we go. So again, same landmarks. You're going to use the lateral epicondyle for your fulcrum. And greater troch is down there. So, and he's going to be at 3 degrees. And normal for that is 10. There we go. So that's the Goni test. Now, Zach, I'm going to have you flip on your belly. And I'm going to start with the hamstring, or the knee flexion test. So, first thing I'm going to have you do, Zach, is bend your knee, this leg. There you go. And come back. Beautiful. So that's a grade 3. Compensations you're looking for are if his hips start to rise and his hip starts to flex, then that's compensation by your hip flexors. If he externally rotates, that's compensation by your sartorius. If he adducts, that's compensation by your gracilis. And if the toes dorsiflex, then that's compensating with the gastroc. So for grade 5, you're going to have them bend at approximately, somewhere between 90, give them a decent amount of flexion there. And so, let me stand. So, go ahead and try and bend your knee, and I'm going to apply resistance, okay? Good. So, grade 5 would be maximal resistance, grade 4 would be moderate resistance, and then the 2 different tests you can try are, so if he inverts his foot, then you can test the semitendinosus. So sorry, I'm going to have you point your toes in. Then you can test the semimembranosus and tendinosus over here the same way. So applying resistance, go ahead. And max and moderate, it's the same thing. And then you turn his foot out, again, you can do max and moderate and test the biceps femoris on the lateral side. So those are the 3 tests there. And then grades, let's see, grade 2 is going to be laying on your side. So go ahead and you're going to have to flip towards me, Zach. There you go, laying on your side. And come as close to me as you can. Good. And you can bend this lower leg. and then you can support it. Normally I'd be on the other side, but because of the bed, and of course I picked the wrong leg so that I could demonstrate it properly, you're going to go ahead and bend your knee again, Zach. Good. And I'm just helping him reduce gravity, so I'm not helping him move at all. He's moving himself. And if he can do that full range of motion, he gets a 2. And then lay on your belly again, Zach. Grade 1. You're going to give them a little bit of flexion. Go ahead, relax your leg, Zach. Relax your leg. And then just ask him to try and bend his knee. Go ahead and try and bend your knee. And you're looking for the tendons to pop up, and you can be palpating where the 3 tendons are. And that's the hamstring test. So quads, testing the extension. I'm going to have you sit up on the side of the bed, Zach. This is a little tricky on the bed. So we try to do it tucking a towel under his leg to see if that would help. I think it's going to help a little bit just because the bed, I'm squishing him down and it's, yeah. So you can put your hands by your side, Zach, to support yourself. So you want to sit up tall. And then it's important to be able to test hamstrings to know like if they have tight hamstrings or not, because if they have tighter hamstrings, then you're going to have them lean a little further back so they don't interrupt the test by getting stretched. So passive insufficiency. So then what I'm going to have you do is straighten your knee, Zach. Good. And come back down. So if you can do that full range of motion, that's a 3. And then go ahead and straighten your knee to just barely locking it out. So you don't want him to lock. But then go ahead and I'm going to apply resistance. Don't let me move you. Yeah. See, I wouldn't want to do it on a bed because this is obviously happening. But maximal resistance, you can relax. Maximal resistance would be a 5. Moderate resistance would be a 4, and then on a 2 would be laying on your side. So lay on your side and face me. Normally I'd be on the other side, but once again I picked the wrong leg. And you start them at 90 degrees. You'd want to be watching to make sure they don't internally rotate and just fall into extension. So try and keep them level and be mindful of how they're moving this. But go ahead and extend your knee, Zach. Good. And relax. So if you could do that full range of motion, that's a 2. And then for 1, lay on your back. And I want you to press the back of your knee down into the bed. Good. And then you want to be palpating just above the knee. That's a quad set. And if they can do that and you can feel a contraction, you got a 1. If you don't feel any contraction, then you got a 0. And those are the Goni and MMT for the knee.